Thank everyone for being here today. This is another press conference to address the COVID-19 pandemic, and of course, this is not the type of event we want to be having. We had promised, the fiscal court had promised to make sure that if there are any new cases diagnosed in Pike County, that we would make sure the public was aware of that. We had a press conference yesterday to announce 2 new cases, and we're here today to announce another case of COVID-19 that was diagnosed yesterday in Pike County. Let me give you the statistics. This is from Dr. Fadi Alacross at Pikeville Medical Center, who is the Vice Chief of Staff and also the Director of Infectious Disease. As of today, April 10th, there were 97 tests, 11 pending, 5 total positives at Pikeville Medical Center, 3 from Pike County, 1 from Perry County, 1 from Wise County, Virginia. The most recent case is a 62-year-old Pike County resident. It is a male who is in critical condition on a ventilator. The first test that was done on the patient for COVID-19 was negative. Dr. Fadi Alacross was convinced that this was not influenza or something else, and he recommended the patient be kept in isolation because he was highly suspicious, and when the test was repeated, it came back as positive. We talked yesterday about the importance of social distancing and proper hygiene. We talked about the importance for people to adhere to the CDC guidelines and the executive orders that have been issued by Governor Beshear and by my office. This disease is capable of getting someone very sick very fast. We've had questions about, can we tell people where the person's from? At this point, everyone needs to practice with universal precautions because you can't look at someone and tell where they're from or whether they have this disease. And a lot of people, as has been reported, can be a carrier of the disease even though they're asymptomatic. So at this time, I'm going to ask Tammy Riley from the Pike County Health Department to come and give an update. But again, we're asking for everyone to please take this serious because we do expect additional cases. We also, as Dr. Alacross said, we expect that we're 3 to 5 weeks from the peak here in Pike County. So please, now is not the time to relax social distancing. And we absolutely, this means there's 2 patients right now on the ventilator with this disease at Pikeville Medical Center. We simply cannot allow this to overwhelm the capabilities of our 2 hospitals here in Pike County. So at this time, I'm going to turn it over to Ms. Riley.
Thank you, Judge. What I thought I would do today is just give a very brief update on the 4 cases in Pike County. Our original case we announced on April 1st, and that's the 28-year-old male, and he is still home in isolation and doing well. And then yesterday, we announced 2 new additional cases. 78-year-old female who is in isolation in a hospital. It was announced by Tug Valley that she was at Tug Valley ARH. Also, we announced yesterday a 69-year-old male, and he is home in isolation and also doing well. And then, unfortunately, we have an additional individual that Judge Jones just referenced, the 62-year-old male, also in the hospital at Pikeville Medical Center. So our regional epidemiologist, Morgan, works with both Pike and Floyd County, and the nurse administrator, Stephanie Bentley, they're putting in long hours working on tracing and monitoring, working with those individuals and their families. And on the latest case, the 62-year-old male, the Pike County Health Department will be working in conjunction with the Floyd County Health Department to ensure that all individuals in contact with the patient will be notified, and we'll be working that very thoroughly. I would also like to just remind everyone and let everyone know that the Pike County Health Department's Facebook page, we posted a very informative and I think relevant video made by my good friend, the doctor, Dr. Fadi Alacross, about resiliency and anxiety. And I think it's very relevant at this time. And I shared it on my personal Facebook page as well. I encourage everyone to watch that video. It's extremely helpful, and I'm very grateful to Dr. Fadi Alacross for sharing his wisdom at this time. Thank you.
There's two other issues I want to address. Excuse me. We have been having, yesterday we had a teleconference with Martin County Judge Bill Davis, Floyd County Judge Robbie Williams, Magoffin County Judge Matt Wireman, and Johnson County Judge Mark McKenzie. And we are trying to work together. I know that our health department is working with Floyd County on at least one of these cases. So we're trying to work with other government entities in other counties to make sure we've got cooperation across county lines. One of the issues I do want to address, and this morning Dr. Fadi sent me a message about, and he was a little bit upset about some of the comments that were made on social media. There were people on there questioning his faith, wanting to know if we had a doctor from here that could address this rather than him, questioning what books of the Bible that he was quoting from. And, first of all, let me say this. When you're elected official and you run for office, you can expect negative criticism. That's par for the course. But the press conferences that we've had Fadi come in and try to educate people so we can save lives. Now, keep in mind, he's taking care of 2 people in critical condition on a ventilator. And Fadi is doing this because he lives in this community, he's raising his family in this community. And when someone said, where's he from? Well, I'll tell you where he's from. He's a United States citizen, and he's from Pike County. He's as much of a Pike Countian as anybody here. And I will not allow people to say something about a good friend of mine who is volunteering his time, who's not making a single penny to come over here and try to educate people. Now, let me tell you something else. Fadi's a Christian. He's a Lebanese Christian. He was born in Beirut. He came from a country where worshiping Christ could get you killed at any time. And I would challenge pretty much anybody in this county to try to discuss the Bible with him. Because there were people saying, well, what books of the Bible was that? Well, the verses he quoted were from Psalms and Romans. I mean, it's amazing to me how people could be so cynical, but these are the same people that are, questioning the social distancing, who are complaining about Governor Beshear's executive orders, or mad because I closed county parks. But if these types of disrespectful comments continue to be directed toward anyone that we bring to these press conferences, I will not have them back on here. And I think it is imperative that we have people like Fadi to come on, because he knows more about this disease than probably any other person in eastern Kentucky. And we are blessed to have him here. We're blessed that Fadi and his wife Lena are raising their family here. But I wanted to point that out because he was very upset about it, and I think he has every right to be upset about it. So I would encourage the people to listen to him instead of criticize him, because the information that he gives to the people of this county may save a lot of lives before this is over. I know one of the gentlemen who's in the hospital on the ventilator. It's a friend of mine. This disease is very real, and we still may have a problem with the testing. The first test for this gentleman came back as negative. But Fadi was wise enough and knowledgeable enough to recognize what he was dealing with here. It is important in many cases for the physicians to use their clinical judgment. That is a message that he wanted me to carry. It is important for physicians to use their best clinical judgment, because the test results may not be accurate. That was the case here. We're blessed that we had Fadi looking at this patient's condition, because he recognized what he was dealing with. He was able to diagnose it and able to get a confirmatory test result. So I would encourage the people of this county, and most of the people of this county do appreciate what has been done in terms of public health and public safety. The people of the county owe the health department and its employees a tremendous debt of gratitude, and they owe our health care providers a tremendous debt of gratitude because they are the ones on the front lines, our first responders, our police officers. They're the ones that are putting their lives on the line every single day to protect this community. And I'm asking the people to recognize that. I hope and pray that we don't have to have any more press conferences, and it may get to the point where if we have enough cases that we're not going to be able to do press conferences. One of the main reasons that we're doing the press conferences, one of the main reasons is so we can keep people focused on what we have to do to try to contain the spread of this disease in Pike County. Because if we get past the containment phase, I think we still are in the containment phase. We've only had 4 diagnosed cases. But if it overwhelms the health department staff, if it overwhelms the medical staff at Pikeville Medical Center in Tug Valley, then we've got major problems. So I'm going to conclude my remarks, and if you have any information about a business owner or an individual that is violating the social distancing rules and guidelines that have been put in place, please contact the health department because public health and public safety depend on that. I have had people question people riding 4-wheelers, trail rides, and that kind of thing. There's no problem with doing that as long as people adhere to the social distancing guidelines. 6 feet away from other individuals, proper hygiene. If we find out that people are, getting together, cookouts, parties, those kind of things, then we will have to get the sheriff's office involved. We simply cannot afford to have our healthcare system overwhelmed, and that is a real possibility. We've seen 3 new cases in the last day, and we, like Dr. Foddy said, we are 3 to 5 weeks behind the rest of Kentucky in terms of the curve. So we're, in my opinion, at the beginning of this, of the progression of this disease into our county. We're not going to know where this is going to end up for several weeks. But what we do now determines how many people are going to live and how many people are going to die. Because if this disease again gets out of hand here with the comorbidities and our elderly population, it could be horrific. Thank you all. Chris?
Judge, a couple of questions. First, this case that you guys announced today, is this directly related to the non-announcement that was made in Floyd County yesterday evening? And then also on the subject of Dr. Foddy, I think I can speak for everyone in this room and express our appreciation for the information that Dr. Foddy has provided. Has Dr. Foddy indicated that even with these racist comments that were made against him, that he would be willing to come back?
Well, first of all, I'm not sure everyone can hear the question. Basically, the 2-part question. One, is this related to the case that was announced in Floyd County yesterday? And the answer is yes. The individual involved has ties to Floyd County, but is a Pike County resident. And there was some confusion. But the Pike County Health Department will be working in conjunction with the Floyd County Health Department in terms of tracing potential contacts with the individual. Second, the second part of your question was whether, even in light of these inflammatory comments, is he still willing to help? Absolutely. You'll not find a better person or a more stand-up guy than Foddy Allacross. And that's in addition to him being one of the best doctors you'll find anywhere. And I would say this with, in all sincerity, we're very lucky to have him here. He could go anywhere in America, and he chose to raise his family here. So but I'm not going to subject him to that type of abuse on social media. He doesn't deserve it. He's over there taking care of sick people today, and every time he goes into that ICU to see a patient, he's putting his life on the line. And what I would point out, Chris, is that the people that are making these comments could end up looking up at him and asking him to save their life before this thing is over with. That's something they need to understand.
To the rest, there was some discussion about concerns about exposure, this person exposing other people to the virus. Any indication about how widespread any exposure from this patient would be?
Well, it doesn't matter who the person is that has this disease. Everybody comes in contact with other people, and that's why the tracing is so important. Now, of course, the business owner, somebody like that comes in contact with more people, the tracing obviously is harder. But that's why the epidemiologist, the regional epidemiologist, is working on that as we speak.
About working together with other counties in this. Can you talk a little bit more about how important that's going to be moving forward since the lines are a little blurred?
Well, I have a great working relationship with the 5 judges that I talked about, Judge Davis, Judge Williams, Judge McKenzie, and Judge Wireman. Actually, the 4 of us. We work together. We get together from time to time. We have conversations about what we're dealing with in our counties. And we had about an hour-long teleconference yesterday just to get together, talk about, financial issues that we're going to have to deal with, talk about, this pandemic and how it may end up impacting the region. Most of the eastern Kentucky counties have had only sporadic cases. But again, we all know that this is going to be something that we're going to lag behind the rest of the state. And we are going to stay in constant contact with the county judges and the fiscal courts in these other counties. And, Tammy and I have been talking about this, and we're trying to make sure that the health departments are working together, because you may have somebody, like in this case, that works in one county and lives in another, or, somebody that may be, working or, coming in contact with people in other counties besides the county that they live in. So it's going to be important that we have cooperation between health departments and county governments.
Have you all been in touch with or working with nursing homes to make sure they have enough PPE going forward?
The health department has. And as we've seen what can happen when this disease gets into a nursing home. Governor Beshear has taken some very wise steps to try to contain the spread. And, our biggest concern, I won't say our biggest concern, but one of our main concerns is we've been working with Pike County Jailer Brian Morris and his staff. We can't afford to have this get into our jail. We've got about 400 inmates in the Pike County Detention Center. And if we had an outbreak of COVID-19 at the jail, it could be a really, really bad situation.
Accepting state inmates right now?
The question is the jail accepting state inmates? Right now, the jail is on basically lockdown. The State Department of Corrections has shut down the inmate work release program, and they are not allowing any new inmates to come in right now. So that's an issue with the jail. Inmates are being released. Inmates are not coming in. That's going to cause a revenue issue at the jail. So, but right now, there's no new inmates coming in.
You mentioned the financial aspect of it. County's not going to be able to collect occupational taxes because people aren't working. Coal severance money's down. Article in today's News Express talked about how the declining revenue could be catastrophic for this community and surrounding communities. Can you kind of expand on the lack of revenue and what you can expect to see from the revenue decreases over the next couple months?
Well, as we discussed yesterday, Mr. Wright here from the Herald Leader, and the question is, how is this going to impact the county's finances, and what can we expect with declining coal severance and occupational net profit tax implications? There was an interactive map yesterday in the Lexington Herald Leader that showed between 2012 and 2018, Pike County's coal severance tax declined 82%. Now, I put that on social media, and people wanting to go in there and they're wanting to blame President Obama. And, for whatever reason, it declined. If you add the 2019 and the 2020 fiscal years in, clearly the decrease between 2012 and now will be over 90%. We budgeted $2.1 million in coal and mineral severance this year. We're on pace to hit about $1.6 million. We think we'll see another $350,000 to $450,000, maybe larger in terms of a decrease next year. At the same time, our costs are going up. Our insurance for our employees, workers' comp and liability are increasing about $345,000 just this year. We're shopping it around. We're doing everything we can to contain that. We also know we're expecting a hit of somewhere around $500,000 for our occupational net profit tax. I entered an executive order postponing the filing deadline for the net profit tax until July 15th, is where the federal and state government have moved the filing deadlines respectively. So we know this is going to have an impact on the county's budget, and we're going to be making some reductions in accordance with that. What people have to understand, Jeff, is we were in a bad position financially to begin with. I mean, let's go back to 2018. The county lost its credit rating. Before this administration came in, the county lost its credit rating. You had 3 consecutive bad audits. We inherited that mess. We inherited a situation to where you had about 4 years left on the landfill, and there was no money set aside to expand it. We've addressed that. We've had to make the hard decision to raise garbage rates. But this court did not raise property taxes. We kept the tax rate the same. That's about a $240,000 hit every year going forward. It's going to cost the taxpayers that much money. We have limited options under existing law to address this. And we're going to have to live within our means, and that's going to mean reductions. We're going to be reorganizing the county's road department to try to save money. At the same time, we're going to have to ask people in the county to have a different level of expectation about the services the county can provide. We have kept our garbage, our solid waste system has remained in operation even with the loss of the inmate labor. And there were people that were, criticizing us for using inmate labor. Well, it saves the taxpayers $1.5 million a year. It gives the inmates something to look forward to get out and do something productive. And we're trying to run this like we would a business. We're trying to make the numbers work. If you go back to what the county dealt with in the past, the county got a $4 million settlement from the OxyContin lawsuit. Not one penny of that was spent on addressing the opioid epidemic. Not one penny. It was spent to pay the county's bills. If you go back a couple years ago, the county was having to borrow money from Community Trust on a line of credit to make payroll. It's not happened under this administration. We're going to run the county like it should be ran. And we're trying to make sure that we have enough cash reserves that we can do the landfill expansion over the next 3 years, replace some of the aging equipment that we inherited. Every court meeting, when you got 20 to 30 pieces of equipment and vehicles in the county maintenance garage, that's a huge problem. We had one piece of equipment last week that was in the garage that the cost of repair was almost $9,000. It's a 20-year-old excavator. We made the decision to park it. You can't justify that kind of expenditure on a piece of equipment that's worn out. So, but on the other hand, people were on Facebook this week complaining because their potholes haven't been fixed. Well, the problem is the asphalt plant's not open yet. It's sort of hard to fix potholes when you don't have asphalt. So, a lot of people here have expectations when, prior administrations threw money around to projects when there was money to spend. And you go back to 2009, 2010, the county was probably getting between the LGEDF and LGEAF somewhere around another $15 to $17 million in severance tax revenue that we no longer have coming in. Occupational tax brings in about $3.6 million, but you can do the math. You're still well in excess of $10 million less revenue now than you were a decade ago. At the same time, everything's going up. Insurance costs for employees. The pension cost is going to be a killer as we move forward. It's going to be a major problem. Fortunately, the legislature froze the rates at 24.06 cents per dollar of payroll this year for the next budget. But if that hadn't been done, but by the last year of this administration, the pension cost would be about $820,000 over and above what we're paying right now.
Does the federal stimulus package offer any relief to counties like Pike and surrounding areas?
We have seen nothing. We know that there will be a disaster because there's a federal disaster declaration. There may be an opportunity to recapture some of our expenditures from FEMA, but it's not going to be a lot of money at this point. We do not have any information at this point about any kind of stimulus money that may help us deal with this. But like I said, we were in bad shape before this. We need somebody in a position, whether it's in the White House, in the governor's mansion, to try to address these problems. Perry County Judge Executive Scott Alexander, who I served, Scott was in the legislature actually before I got down there, a good friend of mine. Scott made the statement that, this is really the second pandemic for Eastern Kentucky, I think was the quote that Mr. Wright had in his article. We were in bad shape already. It's going to be a challenge with the pandemic to keep county governments in the coal fields in operation to where we can even provide basic services.
Let's switch gears a little bit and talk about the food supply. Can you talk about, have you met with grocery store chains and also about food supplies to prevent people from going out and hoarding meat and chicken and toilet paper? And also, can you expand upon the carry-out service for restaurants to continue to support those as necessary, using guidelines to clean boxes and stuff like that?
Okay, and the question is about our food supply, whether we've been in contact. I personally have not, but I have instructed Doug Tackett, who's the emergency management director for the Pike County Fiscal Court. And, we're lucky to have Doug too. He's, recognized statewide. Everybody in the emergency management field knows Doug. Doug is weekly contacting all the major grocery vendors. We have really there's a few issues where like cleaning supplies, things like that are harder to get than food. We've touched base with all the major grocery stores. They're really not having a lot of supply issues, some small hiccups here and there, but no major problems on that. Your other part of your question was, I'm sorry.
Can you talk about carry-out service for restaurants?
Carry-out service. We encourage people to continue to support local businesses. There's a lot of businesses that are going to have a hard time surviving this economic shutdown. We do encourage people that go through drive-thrus to make sure that they're wiping down the containers when they get them. We're doing that at our house. Again, I published on two things. I published on my Facebook page a link to a checklist. If you print that off, or you can just look at it, that will help you. Things like your shoes. I didn't realize that. My wife pointed that out to me. If you're somewhere, the virus can live on your shoes for several days. Those are the kind of things that, pulling your shoes off, keeping them in one place in the house, making sure that you don't have groceries, for instance, in different areas, making sure when you put bags down that you clean that area, cleaning the cartons and so forth. But everyone needs to try to continue to support local businesses to the extent possible.
Yesterday you all mentioned about a couple of cease and desist letters. Have they been administered? What's been the outcome of those? And can you expand on that?
I'll let Tammy come up and address the stay-at-home orders, or I'm sorry, the cease and desist letters. As you know, the stay-at-home orders preclude certain activities. Certain businesses have been shut down. We do have reports that we're investigating about people who are ignoring that. And I'm going to let Tammy come up and address that. But I do want to mention one other thing before I conclude my remarks. The rave alert system that we have here in the county, we've had a significant number of people sign up for that. It's free. It doesn't cost anything. And if you go to the Pike County Emergency Management Facebook page, there's a little blue icon that says use app. If you'll click on that, it will walk you through the registration. That will give you important public service announcements from the fiscal court, from emergency management, whether it's about the COVID-19 epidemic. I know that like 2 nights ago, I received one for a severe thunderstorm warning. And it will give you notices both on your home phone and on your cell phone about, whether it's a severe storm or some other public announcement. So we encourage everyone to sign up for that. So at this time, I'm going to ask Tammy to come up and address the cease and desist.
Before you do that, one more question for you, Ray. You mentioned the negative, as Chris said, racist comments on Facebook. Years ago, if I'm not mistaken, you sued to get information for somebody who was putting negative comments on topics. And you called them out, and this individual had to write a letter and we actually published that to say that they were sorry for doing that and so on. My question is, would you be looking to, there are some things people can say. You can't, scream fire in a loaded
Crowded theater.
I mean, and I know it infringes on people's Second Amendment, but they take it too far
First
Is there-
Amendment.
First Amendment, I'm sorry, I'm thinking of guns, that's what they need, but anyway, would you be willing to take, action against people who are making negative comments on social media regarding the progress that they're doing to private individuals like Dr. Fadi?
Well, let me tell you, you know, my law firm, we've done that on many occasions. We filed several of those lawsuits, excuse me. You know, it's a shame we even have to have that discussion, but, you know, if you do something in public office or you're a public figure, Fadi Alacross is not a public figure. He has not put himself into the public arena as a politician or a celebrity. He's a medical doctor that's trying to help save lives, who's over there right now taking care of 2 patients who are in critical condition on a ventilator. We expect that to happen. We expect that to be something that happens again here, unfortunately. If someone defames him, I would represent him for free. But people need to understand, Jeff, and this is the thing that bothers me. I've tried to stay off social media. But when I see people post something about a politician, I don't care what party they're in, I'll call them out on it. I had someone last night posted something about Speaker Pelosi. I don't agree with Speaker Pelosi on very many issues at all. But it was something that was a satire. It was something that was blatantly false. And if you read the article that the person shared because of the headline, that they obviously had never read, it was satire. It was a joke. And people were sharing it and commenting on it, and they obviously hadn't read it, they just looked at the headline. Social media is a great thing if it's used responsibly, but it also has given a voice to people that really probably shouldn't have one. People are sharing information on there that's false. I had a friend of mine send me an article that said you need to drink a lot because that way if you get the virus in your mouth, it'll wash it down in your stomach, and the stomach acid will kill it. Every medical doctor that I know says that's absolutely crazy. If you get the virus in your mouth, you're probably going to get sick. So, I mean, that's the kind of false information that's out there. You know, what I said yesterday, if you'll give me the facts, if the media will give me the facts, I'll form my own opinions. I don't need someone to tell me what to think, but unfortunately we're seeing that more and more often now. People are wanting to tell you what to think and want you to believe that. So it's important for people on social media to recognize the difference between somebody who's in an elective position trying to do what they think's right versus someone who didn't ask to be subjected to abuse on social media that's only trying to do a public service. And if that continues, I've asked all the members of the press to monitor these comments. Dr. Fadi does not, nor does anyone else, whether it's Andy Bashir, people criticizing him, Governor Bashir is doing what the health care experts tell him needs to be done. He's listening to the public health officials like Dr. Stack. We're listening to the public health officials in Frankfurt and in Washington and here locally. I'm not a physician. I'm not a public health expert. We have people who are. We have an epidemiologist here. We have an emergency management planner at the health department. And right now we have a CDC liaison, Dr. Riggs, who is working out of the Pike County Health Department, was here before this happened. So we're really lucky that we've got resources here, and we're going to rely on those. And that's what they need to do. It's what politicians in Washington need to do, in Frankfurt need to do, and here locally. We need to listen to the medical doctors and the healthcare experts. These are not political decisions. In my opinion, they're medical decisions that have to be made. All right. Thank you all very much. I'll let Tammy address this.
To answer your question about yesterday's cease and desist orders, there were 2 cease and desist orders issued. It was a husband and wife who have individual businesses that there had been complaints that they were working out of their home. And so I had sent the environmental director over a couple of times. And then yesterday, He went over, it was Jackie Kohler, my environmental director. He went over with a city police officer with the cease and desist order. So there were two, and those were notifications basically to cease actions. So both individuals stated verbally to the officer that they would cease those actions, and we're making a determination as the health department whether that will be reported to the applicable boards at the state level. And if those individuals do not cease their actions, then the next step would be civil action. At this time, I have no reason to believe that we would need to take civil action.
How's the effort going at this point to get in touch with the people that may have come in contact with this male subject who is the latest case that was announced today?
The latest case specifically? There has, the regional epidemiologist Morgan and Stephanie Bentley, the nurse administrator, have interviewed that individual and a family member, and we are working in cooperation with the Floyd County Health Department, who had initially, I think, made some contact yesterday as well. So we've had very good contact, and that is, very early in the process, but will be very thoroughly traced. Thank you.
All right, that'll conclude the press conference. I want to thank Tammy and the Health Department again, and if there's any other changes, we will either have another press conference or send a press release out. I think, again, at this point, it's important that the public understands that the incidence of COVID-19 is increasing in Pike County, and we can expect other cases, but we need to try to contain that. Thank you all.